See, we had a very unique patient which came to us a couple of months back, and this was a 40-year-old lady by the name of Sangeeta, who was referred to us by one of our doctors who knew our expertise and who knew we could tackle certain difficult cases. This lady had incidentally been found to have a tumor in the heart. So that was the only diagnosis they had, and once she was told that she had a tumor in the heart, she was in a sort of a semi-panic situation, not knowing what to do, and we went to various places till the doctor told that we probably our institute and with our years of experience, we will probably be one of the best people to manage this patient.
And on 5th of August, I came down to Max. I met Dr. Sandeep Singh. He told me to go for an echo again. Then I had an echo in Max, and then they told me that you're having a myxoma. We call it a mass, and it's a myxoma. So you'll have to go for an open heart surgery.
When we got an echo done, it was a very astounding sort of a picture that we got. The echo showed us that we had a large tumor which was nearly about 5 centimeters plus, which was right in the right ventricle. Now, right ventricle happens to be one of the rare places where to have the tumor. The most common tumors are in the atriums of the heart, which are the receiving chambers of the heart.
So I was very I didn't believe it that something's happened like that, because my life was very smoothly going. But then, and even I didn't have any symptoms of such that I might be having such a big problem, because as I was very much active, I was working very much, everything was going on very fine.
The right ventricle size is generally about 4 centimeters, the volume. Now, a tumor to be bigger than the size of the actually surprised us. So, to have a tumor which is more than that, and she was living with that tumor. And she had complaints of dyspnea, which is breathlessness. When she used to walk, she had a history that she used to have fevers very off and on, and her another complaint was of giddiness, or what we call as syncope in our medical terms. Now, the complaints of giddiness or syncope generally gets related with most of these patients who are a little overweight and young ladies of 40 years with some sort of anxiety feeling. So for quite some time, the treating doctors and people who ever thought of her never thought of the heart disease, never thought of that she would be having anything to do with the heart, and treated her symptomatically for her anxiety.
So at that time I was a little afraid when the doctor told me on 20th of evening, when I was going to be operated on 21st, that this is a very rare case. But the doctor didn't know, but after that we came to know that this is the 3rd case in the whole world.
The uniqueness of this operation was that in my 25 years of cardiac surgery, I have never had to do such a large incision of the ventricle. It was practically cutting one whole portion of the left ventricle for us to deliver that tumor.
When my mother, she spoke to him that you have to do the best, and also he just told me that we can't assure you anything because this is a big open heart surgery. So let's see for it. And it is like removing something from a heart is not very thing, but still we'll take care and we'll do our best.
A surgery in which a tumor has to be removed right from the center of the heart has to be done on a heart-lung machine, which is called a pump surgery. So she underwent a pump surgery, and the pre-planned way was that we will try to do this patient by a less invasive procedure by going through the receiving chambers of the heart or the atria, where if you cut the heart can recover much faster. But once we went through that, and when we went through one of the valves to take the tumor out, we realized the tumor was huge. It was a very big tumor. The valves are of about 3 centimeters in size. The tumor was 5 centimeters. Now, not knowing what the tumor was, we had decided that we will take the tumor out and block. Surprisingly, the tumor was actually attached to one of the supporting muscles of the valve, and that's why she was having a valve regurgitation or a valve leak also. So after we took the tumor out, we repaired this thing, so the valve leak also was repaired.
Doctors say that you are a fighter and you are brave, and when you have a positive attitude, I think so you can do it very well when you have a positive attitude.
She came back to us in a follow-up in a week's time, where she was eating normally, walking around, and she was much happy after the surgery. She still had a lot of dyspnea, but over the 2 months, her breathlessness, her dizzy spells and everything have disappeared.
Max is doing great. If they have surgeons like Dr. Sandeep Singh and all, and has his smiling face and all, and the way he talks and all, that a patient can understand that he's come in the proper hands.